all arthroscopic Popliteus tendon reconstruction with a dual posterolateral portal technique.
These are our disclosures, none of which are relevant for this talk.
For this technique, we utilize an anteromedial and an anterolateral portal, a superolateral portal, a direct lateral portal, and a high and a low posterolateral portal. With the 30-degree arthroscope in the anterolateral portal, we establish a view of the lateral gutter and utilize a spinal needle for creation of the superolateral portal. With the shaver in the superolateral portal, we debride the lateral gutter and we identify the Popliteus femoral footprint. We utilize a spinal needle for creation of the direct lateral portal at the level of the Popliteus femoral footprint. Through this direct lateral portal, we drill a guide pin in the Popliteus femoral footprint. We overdrill this with a 7 mm drill to a depth of about 30 mm after measuring the length of the femoral tunnel. With the shaver in the direct lateral portal, we debride the aperture of the femoral tunnel and we place a shuttle suture in the femoral tunnel through the direct lateral portal utilizing a guide pin. We thus establish the Popliteus femoral tunnel. We then utilize a 70-degree arthroscope in the anteromedial portal and we establish a view of the posterolateral compartment of the knee utilizing a Gilchrist maneuver. With a clear view of the lateral femoral condyle, the Popliteus tendon, the lateral meniscus in the posterior capsule, we create a high and a low posterolateral portal. Ample working space should be provided between these two portals, and the low posterolateral portal should be at the level of the lateral meniscus. With the 30-degree arthroscope in the high posterolateral portal and a shaver in the low posterolateral portal, we debride for visualization of the Popliteus tendon, the musculotendinous junction of the Popliteus tendon, and the Popliteus sulcus. We can also view the lateral meniscus. An ACL guide is placed in the low posterolateral portal and a guide pin is placed for establishment of the tibial tunnel at the correct position. This is overdrilled with a 7 mm drill and a shuttle suture is placed and retrieved through the low posterolateral portal. With a 30-degree arthroscope in the anterolateral portal and a view of the lateral gutter, a suture retriever is placed through the direct lateral portal, medial to the lateral collateral ligament and into the posterolateral compartment of the knee. The 30-degree arthroscope is placed in the high posterolateral portal and the suture retriever is used to retrieve the shuttle suture from the tibial tunnel into the direct lateral portal. This suture retriever is utilized through the direct lateral portal to retrieve both the shuttle sutures from the femoral and tibial tunnel to avoid a suture bridge. The view is with a 30-degree arthroscope in the anterolateral portal of the lateral gutter. The Popliteus tendon graft is pulled through the direct lateral portal into the tibial tunnel. We visualize this with a 30-degree arthroscope in the anterolateral portal. We can also visualize this with the 30-degree arthroscope in the high posterolateral portal. Here we can see the Popliteus tendon graft clearly entering the tibial tunnel. Next, the Popliteus tendon graft is pulled into the femoral tunnel. We aim for an ingrowth of 15 to 20 mm in both the femoral and tibial tunnel. The Popliteus tendon graft is fixed into the femoral tunnel with a 7 by 20 mm bioabsorbable screw through the direct lateral portal. And it is fixed into the tibial tunnel with a 7 by 20 mm screw. We aim to visualize the tip of the screw for adequate fixation.